New Zealand's mental health and addiction services are so stretched, even heavily addicted criminals in government-run initiatives are waiting up to 5 months for treatment. We're talking about high-risk, high-needs offenders going through the specialty alcohol and other drugs courts in Auckland, a pilot that aims to treat addiction as a health issue and keep people out of prison. So there is a real emphasis on getting people treatment. But they can't get it. After pleading guilty, acknowledging they have a problem and then being accepted into the courts program, they still face lengthy waits. In one case last year, 154 days, 5 months, just to start treatment. Our excellent reporter Zac Fleming has more.
At 37, Mark Cowan's path had forked, and it was up to him where he went. Charged with multiple offences, his choices were intensive rehab or around 3 years in prison.
Crime, drugs, prison, and release, crime, drugs, prison. That's what we call a revolving door. That was my life. Committing offences, you know, like fraud, theft, whatever it needed. I was an opportunist.
That was 5 years ago, and fortunately for Mark, it was the same year 2 special new therapeutic addiction courts opened in Auckland.
When I graduated, I was number 13. They came through the court.
Officially called the Alcohol and Other Drug Courts, AODT for short, their aim is to treat addiction as a health issue, fix the addiction and hopefully stop the offending. It's a $4.1 million evidence-based pilot backed by the Ministry of Health, the Ministry of Justice and the justice system, treating criminals who need help and want help, and it's lauded by treatment providers.
Fabulous initiative.
Marvellous.
Definitely helps people with a major drug addiction.
And yet, like much of New Zealand's addiction services, it's plagued by long wait times. Someone waited 154 days for treatment at the Auckland AODT court last year. That's 5 months. And at Waitakere, the maximum wait, 106 days.
People, when they're ready to get help, they can't get it immediately. And that's a problem.
That's the director of the Salvation Army's addiction services, Lynette Hudson.
Well, there's definitely not enough money going into the drug courts at the moment. There needs to be a lot more.
Johnny Dow, the director of Higher Ground, and here's Fiona Trevelyan, the CEO of Odyssey, who paused when I asked if she was surprised that even in government-endorsed initiatives, addicts face long waits.
Well, it doesn't shock me because I'm so used to it, I guess.
Those with severe addictions who need a bed in a rehab centre wait the longest. Mark says he sat in a cell for around 2 months in 2012 until he got a bed at Higher Ground.
I remember it clearly. For me, it was all these new things were coming, all these people were supporting me, but I had to stay in prison for Christmas and New Year's. And I remember them clearly, like it was yesterday, you know, because I knew that something was coming up for me.
Last year, the average wait for a bed through Auckland was 67 days, Waitakere 57 days.
The system's clogged up and we can't get more people in. That is not a good place to be, because you know that you could do something to help them, but you just don't have the resource or the capability.
Treatment through the AODT courts, intensive and complex. It can last a year and a half or even longer. Only 100 people are accepted each year, and around 2/3 relapse and fail. They exit the court and go to prison. But for those who graduate, the reward for completing treatment is big. A reduced sentence, sometimes no jail time at all.
So they put me on probation, you know, and they cut my string, so to speak, you know, cut the umbilical cord and said, go out into the world. But by then I already had built up my support networks.
So you went from potentially 3 years of prison to probation.
Yeah.
Pretty amazing, right?
It's crazy, you know, and yeah, I did, you know. I didn't commit crimes for 22 months, you know. I had found myself again, you know.
And New Zealand benefits.
They are productive members of society. They're earning, they're paying taxes. So in that way, I think the benefits are significant.
Together, Odyssey, Higher Ground and the Salvation Army provide all of the treatment for the courts. And all three say cash is ultimately the key to cutting those long wait times.
But it would probably take a lot more money, because what you'd need in Auckland is another facility.
More money, more staff, more options.
If we had more money, we could extend the services that were offered.
And all three say it is really in New Zealand's best interests to spend money to cut those wait times, because society benefits. Early indications are the courts actually save the country money, because less people end up in prison. Plus, they improve health, employment and other outcomes for offenders and their families. Mark now works for Odyssey, helping people who are where he was 5 years ago.
Yeah, I know a lot of people from prison, you know, and when they see me change, and they know what I was like in prison, you know, or what I was like on the outside, and they look and they go, look at Mark, look at him, he's a totally different person. And I suppose they look and they go, if he can do it, I'm sure as heck I can do it.
The court's funding's been set aside until June 2020, but that's static at $4.1 million a year, meaning the current 2-month average wait time for a bed could increase as costs rise and providers struggle to do more with less. The providers have a simple message.
Spend more money on residential services and treatment rather than prisons.
And so does Mark. Without the AODT court, where do you think you would be today?
There's the two options. I'll either be dead or in prison. Yeah.
For Checkpoint, Zac Fleming.
Nick Monroe, the cameraman and editor of Zac's story, we asked the Ministry of Justice about the 2-month average wait for treatment. It said some people face longer waits because of bail conditions, like needing a bed in a rehab or a suitable address, but it wouldn't answer whether 2 months is acceptable.